can you stand on one leg for up to 10 seconds without significant wavering in the foot? If you can stand on one leg for 10 seconds when you're 70, your likelihood of living another 10 years goes up 100%. If you can't, it goes down to a higher likelihood of 2 years. Start working on it now. It's such an easy thing to do. My wife's uncle having his 95th birthday, and he loves to brag about how he still does the same number of push-ups as his age at 95. Are they great push-ups? Probably not, but he's still doing them. He's going through that ritual, right? And engaging that part of his neuromusculoskeletal system. Now, he read one of my insights recently, and it was about one leg stance, and he said, "Hey, I'm having trouble with the one leg stance thing." And I said, "Well, you should have started that one a while." But he's, I mean, 95 push-ups a day. That's just wonderful. Yeah. When I say we make physiologic change in these individuals, we're actually able to see it. So in sometimes weeks and short months, there's a courage piece that we sometimes talk about for the individual. They have to have courage to really go after this, to work at this, to change their physiology across 2 years. Takes courage, and it's really fun when we see it happen.
Welcome. My guest on the program today is Dr. Clayton Skaggs. Dr. Skaggs is founder and CEO of the Central Institute for Human Performance. Dr. Skaggs is well known in the college, professional, and Olympic sports world for his work on mind-body interactions. His views on what separates elite from average could have profound implications for you and I when we think about our health span. We also talk about awareness between average and elite, which also has nothing to do with natural ability. It's a unique conversation and one that highlights opportunities to do some simple things that matter more than we probably think. And finally, he's got a big, hairy, audacious goal that we'll talk about that might just include you. It all sets the stage for the upcoming series I'll be sharing on preserving what really matters, your functional age. Lots more to come on that, so be sure to subscribe to catch them when they drop. Now, let's get on with the show. Dr. Clayton Skaggs, great to have you on the program today. Welcome to the Healthspan community.
Thank you, Scott. Really a pleasure to be here. And looking forward to this conversation.
As have I. I thought I'd tee it off with what I would say is just a really exciting and clearly big goal that you have. And you stated to me that your mission is to move 100 million people. Tell me a little bit about kind of what that means, and we can circle back to it later and give people probably a little bit more in-depth context after our conversation. But
sure, yeah, it does. It does get people's attention, that big number, and I can see some people have a bit of hesitation, and that's part of the intent, and part of the intent is really to do that, to move 100 million people to doing what matters for them. And it's also the name of my book, The Power of Doing What Matters. But certainly, I'm not encouraging 100 million people to buy my book. That'd be okay. But it's to do what matters, to garner that mind-body resilience that I feel is in all of us. And I think that that gap of what we know is good for us, be it reading, exercising, eating colorful foods, to doing those things is I think something that's really missing in our approach to health, happiness, longevity, and having a good full life.
right, in terms of, and I think the distinction is what matters versus just the busy time that we can all look in the course of a day and realize, like, what did I do in the last hour that really mattered, right? I've had countless times where my wife's gone out to run an errand and come back and, like, okay, I know she did something. I'm not sure that what I did in the last hour really
Mm.
really mattered all that much. Maybe just to give people a flavor of the kind of work you do, we'll get into it. But you've worked both with a lot with professional athletes and with the average Joe on the street like me. Um, Maybe you can give us a flavor of the nature of the work, and then there's a story you told me when we were prepping for this around the baseball player and the pitcher. I won't kind of give any more away with that. But I thought that was just an interesting way to kind of capture what you do is clearly, I think, a pretty unique approach.
Yeah, we've been really blessed. The different individuals that have come our way over the years, elite baseball players, elite golfers, elite dancers. We've worked with some of the most elite dancers in the world. Elite military. Those are some of our favorite folks that we get to work with. And then everyday individuals like you and I, executives, academics, physicians, moms, plumbers, electricians, that we take in where they are, what is challenging them, be it pain, be it function of movement, be it they're trying to be more fit, less obese, or just not in a good body composition place, or to just be a better performer in their task or sport or career. So it's a pretty broad approach that we're capable of applying to, and and we do it through physical medicine, exercise, diet, nutrition, and then what has led to the publishing of this book, the emphasis on our mental, our work within really improving someone's thinking or behavioral approach to getting around some of these things. And so we look at all those things. Often there's one category that's more relevant for each individual. So someone that is eating really well and hitting the target for their diet and nutrition, we don't need to spend a lot of time on that. But we may need to spend a high percentage of time on their dysfunctional movement, or what we've seen, and why, again, why this book has come forward, is one of the most potent areas we can influence is what they do and why they do it. And that's that mental side, that habit side, that behavioral side, which is certainly nothing new under the sun, and is gaining a lot of, a lot of attention in the last 10, 20 years. And yet we don't do it. We know that we should spend some time on leisure. We know we should spend good time exercising, in equivalent to all the time on work, and yet we're not necessarily doing it.
Right. Yeah, it's a it's a challenge to be objective around a lot of those things. I think that's something else we're going to talk about too in terms of subjective versus objective um, self-evaluations. You told me a story about the pitcher, so and it kind of ties into what I think it just captured a surprise application of just what you're talking about.
Yeah, sorry, I get off on my track, and I forgot your story. So
I asked you a long question, so a six-parter.
yeah, the story I think we discussed was a high level pitcher, one of the top pitchers in the league at the time, and I think currently. And we'd worked on some pain issues he had, and had helped him with those, just some general neuromusculoskeletal function. And as part of that, I began some resiliency coaching with him as part of what we do. And as we dove into his his thinking, his experience during his pitching activities, and you and I were exploring that, how important that is, the sensory awareness that we have or we don't. And I was asking him what he felt out there, what he was seeing, what he was hearing, and we identified that here's a guy trying to throw a small ball at a high velocity, and the goal of that, that pitcher is so the hitter can't hit it, and he and the catcher are are trying to hit a target that'll make that happen. He identified through our exploration that he wasn't even looking at the target before he threw the ball, and which was a big surprise to him, and certainly me, and but exciting. And I think we talked about these elite folks. Once you identify these things and show them what they are doing that they shouldn't be, they they change it. And as he did, he just really took off after that. Um, and maybe one of the other stories I think I was describing to you was another pitcher that identified he was chewing gum on the mound, which I tell anyone who's chewing gum, it's the most ridiculous thing to do. You only have so many good chews in that jaw. That's a very complicated system. And chewing gum is like doing this with your shoulder, just repetitively, and not doing it well either. Chewing gum, you're really creating a lot of aberrant motion in your jaw. And so I said, "Hey, what do you?" And we're working on neck and shoulder tension, and he's out there chewing gum in the most intense time of his game, and he never did it again. He just stopped it right then, which is it is saying something. I mean, it'd be like um, telling telling you to, hey, don't 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 take that turn going to work anymore. Don't don't make that left turn there again, and not you not ever doing it. So
Right, and I think you really make the point around the differences between elite performers, and I can just say elite performer doesn't mean athlete, right? Elite
oh yeah,
performance is what's
moms are some of the most elite performers. Yeah.
right, is what separates people from kind of the average of, because if we say around habits, just habits in general public is generally resistant to change habits.
Hmm.
It feels like a really high bar. They've got to understand, why, what's involved, and and that letting go of something that may provide comfort or whatever, right? I've long wondered about the whole like the whole baseball thing, right? Of the chewing tobacco and uh, clearly the health benefits. I've never run across any. These are people who are, you know, athletics is their form of money. They're not in an impact sport. They're not there to beat up on each other. Longevity would be of high value to them. At what a baseball player gets played to be able to extend your career one more season, that's worth several $1 million. What would you and I do, right, for an extra $5 million or whatever it is? It's so, but I do believe, as I think you do, there's more to this than money. That might seem like the motivator, right? But maybe that just helps for them to be able to make the connect. Because, for example, go back to the pitcher. If my ERA changes by 10%, I could be sent down, right? So they
Yeah,
know that there are consequences, which the rest of us, it's typically it's much grayer area. It's far less urgent, right?
for sure. And I think the motivating factors that often lead these difficulties of change, or the lack of the motivation factors that that don't necessarily move them, is that they're used to things that what's more familiar seems right, or more what's more familiar is is what's linked to the previous success. Or and for other folks, what's more familiar is what they've done, and what's more familiar is what a lot of the other folks are doing. So so it's to say, hey, stop stretching. You're flexible as you need to be. You need to stop stretching. That's contributing to your pain. But well, that's a real tough thing to get someone to do, because it's familiar. It's linked to success in the past, and everybody's doing it. Well, so and so said that they did this stretch and it helped them a lot. So those, I think that's a big part of the challenge of habit change, for what we know is likely good.
Or that example as you're describing, I think would likely take someone to a like almost like a mindfulness state, which is they appreciate that quietening of everything down. And the fact that it's stretching, it could be any number of things that the rest of us do. It's really not about stretching at all. That's maybe ultimately what's taking them there, right? Yeah,
Mhm.
in everything, as I look across my career, it's been all about change and eventually trying to help lead other people through change. And that, uncertainty is, and I don't like uncertainty any more than the next person. I think that's, I had to remind myself of that often enough, because whenever it was thrust on me, it was, I had often would have the same reactions. But it's through some practice and working with others, you start to become aware. You mentioned the book a couple of times, and you were kind enough to send me a copy, which I carried and or I sat on a shelf for a while. And I recent trip to Italy, I decided to throw it in the bag because I know with travel, at least on the commute, I often have time to read, and so I was fortunate enough to remember to pull it out on a train trip from up in the Italian Riviera. It's known just I guess around the corner from the French Riviera, on the way
Yeah.
back to Rome. And what really struck me about it was that what was so unique about it was you're speaking of awareness
Mhm.
in terms of and self-awareness in terms of body awareness. And it struck me that how little attention is given to that. We see it happen when people go through whatever we call a transformation, right? Whatever that is, whether it's a weight loss, whether it's a new activity, whether they get to another level in a sport, there's some transformation happens. And I can't think of an example when you go through a life transformation where self-awareness doesn't play a big part, because you start to become aware of things, which is because there's been go back to that change, right? And I think that's you've just raised it up that it's clearly a conscious or intentional part of how you work with people. Is that fair to say?
Oh, very much. And we're learning learning all the time, ways to get better at it. But clearly we've identified it is it's essential for many of these cases we see, and we see complicated cases from all over the country, and sometimes consult them virtually all over the world. Uh, this part to build awareness in for noticing the good things, uh, and decrease the noticing of the undesirable things, is essential. It's it is the game changer for many of the complicated chronic pain cases we see, and it also performance gains for folks trying to really do important things. And the part that is sometimes difficult, I think, is you have to start simply. And so one of the exercises in my book is just holding two glasses with unequal weight and exploring and experimenting with discerning the difference. And that's a really simple exercise. Uh, and how squeezing the glass makes it harder to sense the difference. And loosening your grip makes it a lot more available. And it's kind of fascinating. Folks that are over noticing or are not in tune with their senses, they have a hard time feeling the difference at all. When you say, "Hey, you notice the difference when you squeeze and let go lightly?" I don't know, kind of, not really. The real tuned in athletes, I mean, they'll, and you can tell too right away. The 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 information's landing in their brain. And so, as I was saying, you have to start really simple to recapture this awareness so that it can build for the more complicated things like pain or tuning in and tuning out on the putting green or tuning in, tuning out in a race car or delivering a baby. Those guys, the moms, and we've worked with a lot of pregnancy population over the years. Their ability to notice what they need to notice and then not notice uh, the undesirable things is, a great study group. They're amazing at doing that.
Lots of things popped in my mind as you were describing there. I was thinking of the golf swing as one which as most of us is largely feel and make one small change that you key into, and it's pretty hard not to notice all the things that are connected. Right, could affect your timing and any number of things. I always remember I was in a group session with there was some amateurs and pro triathletes there, and one of the pros was giving a talk, and during the Q&A, and I asked him a cycling question. I said, so when your cycling is feeling good, it was actually a question of awareness that, as you're talking about here. Um, do you have a sensation of relaxation at all in your legs? Um, and he kind of looked at me like, he didn't know. And he's a big kind of power guy.
Uh, hmm.
And so the reason I asked the question was because when I was cycling kind of at my best and feeling really efficient, I could feel. So the recovery stroke, for people who don't know, cycling is when that foot's at the bottom, it's got to get back up to the top before it goes down again. And any
Mhm.
pressure on that foot means the other foot is having to not just push the bike and you forward, it's also having to do the work to lift that other foot. So if you can relax and just use just enough effort to bring it up at the speed, not necessarily pulling, you can in some cases, not very efficiently usually, but so those are moments like when you're in the zone or something, you're feeling
Mhm.
really good, not when you're tired or you're trying to power up a hill or something. But those, I've had little glimpses of those things in my time,
Hmm.
and I'm always fascinated. That's why I think when I started to read about it in your book, I was keenly interested in kind of digging into that a little bit. So if we take that from, I think, the sport, or kind of when we're in the zone or whatever that might be in our sport, maybe more obvious to people. How does that work for the person with chronic pain who is just having a hard time letting go of, I assume, just focusing on the pain? And where do you start with that?
Yeah, I mean, certainly we try to begin building modes of parasympathetic activation is in as many ways as we can. One of the easiest ways that we do it is with a breathing practice, and that's a simple one where you lay on your back, put your legs up. It's demonstrated in the book. Nice, good, supportive, neutral position, and begin with simple belly breathing, which most people aren't doing, and keeping in that form of belly breathing for up to 15 to 20 minutes. And as we talked about earlier, it's not about doing amazing breathing technique, and there's a lot of breathing trending out there right now. It's largely about laying there and actually focusing on breathing and putting attention to something that is of high value, diaphragmatic breathing, for 15 to 20 minutes. A lot happens there. We have folks come back and say, "Oh my gosh, I'm more relaxed than I've been in so long. I've been doing this twice a day," and young kids saying, "Oh, I'm focusing better in class. I'm sleeping better." Um, to adolescent kids. I've got one family in Kansas that is really exciting. They've got about four youngsters, and the mom and dad are clients, and they brought a couple of their boys in, but they have a nightly ritual where they all lay down and do their diaphragmatic breathing, and the parents are saying, "Oh, they're sleeping better, they're running faster," so lots of fun things. So certainly that breathing practice is an important one, but also to encourage them to do more novel movements in our gym that we do our rehabilitative work. We'll teach skipping. We'll have them pursue some form of juggling. Juggling is one of the best parasympathetic activations that you can do. And what do most people tell you about juggling? Oh, I tried it. I can't do it. Well, just one ball juggling actually is super beneficial if you just get really good at tossing it up in the same place every time. That's relaxing. It creates focus. It's meditative. It actually grows brain cells. I mean, yeah. So why wouldn't you do some form of juggling? If you get really good at one ball, two balls gets really easy, then three. And it's actually, as you touched on earlier, it's a form of that relax, contract, relax, poised approach, which is you can't throw it in the exact same place if you're not relaxing your hand all the way up to the very peak of that toss, and then to catch it with a relaxed hand is. And so, what if you get good at this? You're in a mode of flow similar to what you described on your bike, and so if someone can get in a mode of flow 2 to 3 times a day, they're going to start changing their nervous system. They're going to start transferring all that sympathetic override that's noticing every little signal in their body that most of us never notice. I mean, we have all these signals going on all the time, and we're not intended to notice them. And unless we're about to get in a fight, or we need to run from a fire, that's when we should notice all these really hypersensitive things. Not when you're sitting in chair.
Interesting. Have you done any work to connect that to heart rate variability?
Oh yeah, there's a couple studies that show juggling actually improves HRV for sure.
Yeah, as you're describing, I think because
So,
the things to improve HRVs are following much the same, right?
oh no, there's all these things, diaphragmatic breathing too. I mean,
Yeah, and can you talk a little bit more about the belly breathing to kind of explain what that is?
the actual practice of it.
Well, if someone's well, if they're driving the car, probably hopefully not going to try it. It might be Ken
Yeah.
driving a car. I don't know. Depends on
So
on
after a
how much
while,
traffic there is. But so, whatever situation, I guess whether people are seated or not. What's involved? I just hate to assume people know when we throw things out that it's kind of foundational to the conversation.
sure. So if you're sitting right now somewhere, simply put your hand on your chest and one hand on your belly and take a good few breaths in and out. Most of us are going to notice that your upper hand moves considerably, and that's not ideal. You know, when you get into the a real full inhalation, yeah, the chest should move more. But for this diaphragmatic approach, what we're trying to stimulate in terms of the diaphragm and a good trunk dominance, uh, the lower hand on the belly should be all that moves. So take a good breath in, trying to only move that lower hand through the inhalation and exhalation. And so you can work at that sitting. It's harder. It's harder to gain prowess in the sitting position. So that's where we start people laying on their back, head on a pillow, legs up on a little bench or up on a couple pillows, because that's the easiest position to gain really good awareness and control of belly breathing. And uh, it's not surprising. That's the most ideal, stable position to do that in. If you look at an infant at 6 to 9 months of age, that's what they're doing. They're laying on their back, their legs are up in the air, they're fiddling around with their feet, and they're engaging their trunk and breathing through their trunk. They're building uh, truncal stability, neuromusculoskeletal stability to get ready to turn, crawl, and then walk. So it's if you really want to learn what to do, watch those guys. In almost in almost everything, as I talk about in the book a little, the you know childlike childlike behavior, childlike activities that we can learn a lot from that. And actually, I know they're studying AI and robotics. They're studying kiddos. That's where they're learning the most.
Interesting. You, a lot of the things that you talk about are surprisingly simple. Right?
Hmm.
It's the understanding clearly that you and your team have is where the brilliance is, but the doing, which is what we can all do, we don't need to necessarily have the understanding to be able to do them, which I think is one of the really appealing aspects of your work. Um, and as we talked about before, it's kind of just an interesting coincidence here as I've been doing a bit of focus this year on functional aging is really
Hmm.
that practical aspect, that things that we can do essentially measure where we are on the spectrum of our own age, but relative to where we think we are relative to the world around us. So kind of pulling back to what I mentioned earlier around subjective versus objective comparisons. So if we can think about functional tests that I know this is a big part of your work for lots of reasons, but there's so many things that I think people can be doing at home and evaluating themselves, regardless of whether they are trying to be an elite athlete or they're dealing with chronic pain. Those are not requirements to do this, right? Because ultimately, it's really helpful to know where you are
Hmm.
by some objective measure, and that's often we go for professional help. Is one of the things we're looking for is, well, where am I, like in terms of how bad is my pain? I'm giving you, you're asking me a number, for example, right? So you're
Sure.
immediately qualifying, well, that's normal for whatever, perhaps, or you're in a recovery state from an injury. It's going to come
Hmm.
down. It's going to be 6 months until it's down to a zero. So with that, kind of prefacing it, to talk a little bit now about functional testing, where we are now in the context of looking forward to aging. I think you have some really helpful insights on that in terms of what can we be doing, whatever age we are today. It's not age dependent. Why would we want to be doing some of these things today?
Yes, that's really at the cornerstone of I think what is going to move things for individuals. It's also what's going to move things for our healthcare culture and certainly our approach to these chronic problems is to do things now versus wait until there's a problem. And it's not not rocket science, as we say around the institute, to to think about that. Well, and this whole idea of prevention, oh, it's really, really exciting and it's the way to go. And and yet that's not what's being done. And again, the cornerstone is that it has to be simple enough for folks to do on a regular basis for a long time, because that's what really changes things. So, for example, to do this diaphragmatic breathing that we prescribe just for 2 weeks and then stop is not going to have the robust change. But if you do it for a couple months and on a consistent basis within the prescription, you can change your physiology. We see it all the time. People gaining muscle, losing fat, and changing their pain. So it does have to be simple enough to be completed for a good time. Most things, eating a colorful plate, same thing. Uh, and then back to then how do you know where you stand? That's an important thing to understand so that you know what to do and when to do it. And so one of the things that you should be able to do and could be a barometer for you to see where you stand is, can you stand on one leg for up to 10 seconds without significant wavering in the foot or wavering in the body? And ideally barefoot, but even in a shoe, that's a reasonable test of where you are. And then there's data on this, and we talked about that the other day. If you can stand on one leg for 10 seconds when you're 70, your likelihood of living another 10 years goes up something like 100%, like just through the roof. Your high likelihood of living longer. If you can't, it it goes down to a higher likelihood of 2 years. So, and so the importance of being able to stand on one leg, and there's more and more research on that, uh, is is very important. It's high, and yet we don't usually practice it until later. And when we've had a knee injury or we've had some balance disorder, oh, you need to start working on staying on one leg. Well, start working on it now. It's such an easy thing to do. And then simple activities like getting out of a chair without using your hands. So you should be able to get out of a chair without using your hands. And the default is to begin using your hands. And so here's a here's a real important message. Don't start. So if you notice you're having trouble getting out of a chair without using your hands, you need to get to your circle of advisors and find out why. Or you may just need to change your habit, stagger your stance so you can propel out of that chair. And that usually is a pretty easy fix. But sometimes there's a reason. Your trunk is weak, your legs are weak.
And
So,
it sounds like for someone, if they are able to do it, then why not make that the habit?
oh, yeah. And those that do, it's just like I've got a my wife's uncle. I think he's having his 95th birthday, and he loves to brag about how he still does the same number of push-ups as his age at 95. So
Is
he's
that right? Yeah.
95 push-ups a day, apparently. And are they great push-ups? Probably not, but he's still doing them, and he's going through that ritual, right?
Right.
And engaging that part of his neuromusculoskeletal system. Now, interestingly, he read one of my insights recently, and it was about one-leg stance, and he said, "Hey, I'm having trouble with the one-leg stance thing." And I said, "Well, you should have started that one a while." But I mean, 95 push-ups a day. That's just wonderful. Yeah.
You've kind of mentioned now working with older adults. What's your view on the opportunities for working with older adults in terms of the opportunity for them, right?
Mm.
Where the society generally will tend to discount older adults, and it's too late now, and lots of reasons you're never going to be good enough that it's going to matter, and all the reasons to not do something. What's your experience for the older adults you have worked with?
We have great success with the older population. Clearly, sometimes there's um, structural limitations with some degenerative process, but we're gaining muscle in 78, 80-year olds, changing body composition, obviously, restoring their pain syndromes, but uh, seeing just distinct physiologic change by doing these simple things. And I think it was Gilbert's study on our thoughts about how much we think we're going to change. And this just gets a lot to your work, I think, that we think we're not going to change much. When he studied 19 somewhere around 19,000 individuals, and the summary of his this study was, we're as humans, we don't think we're going to change much. We think we're wherever we are in our point in life, 40, 50, we're we're doing great, and if we just keep doing what we're doing, we'll we'll still be the same. And so I bring that up because one of the things we do at our institute is photos, and they're very standardized, quantitative measures, qualitative measures, but they're photos, and individuals look at these photos and they they're like, wait, that's not me. Wait a minute, that can't be me. And I think it's relative to these ideas. This we think history's stopping where we are, and no, it's moved forward, and that's what you look like now. Um, so when I say we make physiologic change in these individuals, we're actually able to see it. So in sometimes weeks and short months, we make physiologic change in these 78, 80-year olds uh, through simple things like breathing and um, you know uh, simple stabilization exercises, and often it's stopping the undesirable things. So stopping the other 40 minutes of whatever they're doing that was missing the target. And that's often the distinction, I think.
Which is probably things like sitting with poor posture would be an example of,
Yeah.
right? It's we talk about time in front of, or time at a desk and time in front of a screen. Well, that's one part of it, but what's your posture while you're there is probably the more important part, I would gather.
Certainly, there sometimes are significant activities of daily living that will put a lot of emphasis on modifying how they sit, how they get out of the laying position, getting out of bed, things like that. Walking. Interestingly, the way people walk gets habituated to their dysfunction. And so we can do the most amazing manual work or exercise, but they keep walking poorly and short stride, or with this behavior that's part of their adaptations. Yeah, you can't fix that. It's just like you can put a new tire on a car, but if the alignment's off, it's gonna have a challenge again.
Great
And
example. What is there anything you'd suggest to people to who, because lots of avid walkers out there, of something, and that's a time when you actually have to think about it.
yeah, yeah.
Is there guidance or suggestions you would offer to people to say, well, when you're out walking, do a self check on anything? Is that something they can do themselves?
Well, certainly to just take good full strides, swing your arms. Stuart McGill, one of my colleagues from Canada, he's always put a lot of emphasis on really getting a good full arm swing, and so doing that. But actually, and it's something we do at the institute is put some attention to the bottoms of your feet. So, and this gets back to some new awareness, uh, and think about a tripod on your foot, the outer edge of your foot, the ball of your foot, and the heel of your foot, and just think about that tripod as you're walking. All three of those points should hit, and that's a whole new ball game for so many folks, right? They're especially the older population. They're looking down. They're they're limiting their stride and their arm swings because of any number of things that they've been influenced by. So start swinging those arms, bigger stride, thinking about these spots on the bottom of your feet. You'll see a more vibrant individual.
Will stride length typically go up when they start to do that? I'm just trying
Oh
to
yeah,
picture what's going to happen.
100%.
And so their pace
And
will go up.
stride length, pace, and trunk engagement. So you'll get better trunk engagement. So it's it's sort of fascinating, undesirable. As we get pain or we get weakness, the tendency is for us to move less and move shorter, more poorly, right? And that only creates more weakness and vulnerability.
And as you describe it there, I'm thinking it's no surprise if you think of one of the functional tests is walking speed. Right? So
Mm,
whether it's a 6 minute walk, mile walk, whatever, um, ties very much with longevity and health span expectations. And
mm.
big surprise, the faster you walk, the longer we would expect you to live and the longer we'd expect you to remain healthy. Easy thing to test. So, and as
Yeah.
you start to be more intentional, you're probably going to start to do the things you're talking about as well. When suddenly pace matters, right? I think that's the thing. It's
Mm.
there. It just, we get lulled into habits that aren't necessarily in our best interest without consciously doing so. It's not that we're lazy. It's just
Oh,
we're lacking intention, right?
I think lacking attention and lacking instruction. And this gets back to, I think, something we talked about the other day. Now, maybe more than ever, it's always been the case, but now maybe more than ever, your circle of advisors is so important. So
You
who are
you
you?
read my mind. That's exactly where I wanted to go. You raised that up earlier, and I wanted to come back to it. So, circle of advisors, because I have a similar approach when I think about the whole housing scenario. What does it mean to you when you look at patients?
You want someone that is going to one have a thoughtful, caring approach, and they're listening uh, to you. They're making decisions, helping you make decisions about you versus the latest trend, their their mode of activity and what they do. So so in my field, so if it is a surgeon or if it's a physical therapist, that they'll make recommendations that are outside of their field. And so and when someone's asking me, hey, how do I know this is a good practitioner? Well, are they listening? Are they really spending time with you? And do they seem to make recommendations outside of what they might do? Um, and so that's that's what I look for in someone that I might work with, that they're being logical, they're that they are caring and authentic as much as you can discern that.
And as you're describing it, someone who's willing to tell you that they don't know, that's
Oh
not something that they have expertise in, right?
yeah,
Is
well
often one of the best qualifiers to hear that once in a conversation is usually quite reassuring.
Yeah, and our team there at the Institute, I'll try as best I can to applaud someone that says they don't know, or the other thing that I applaud is if someone says I messed up, I did that, and so whoa, that's fantastic.
Right. Well, I know from my many years in research, those are where the biggest learnings are. When a lot of it's already understood, it's fairly easy to keep, rinse, repeat, rinse, repeat.
Hmm.
Sometimes out of the mistakes come some new opportunities to learn. You've mentioned the Institute a few times, and I haven't really given you an opportunity to talk more about that. Can you give me a sense of like the type of staff you have? You've talked a little bit about the type of patients you see, but maybe you can give us a sense of, well, one would be where is it? I haven't given you a chance to talk about that either. But
Yeah, we're located in St. Louis, Missouri. Have been for now 22 years, and just an amazing group of individuals there. And we have had over the years just some real talented folks. And right now we have doctors of chiropractic, physical therapists, certified athletic trainers, strength coaches. We've had uh, various MDs at different times, and dietitians, and so with a couple of our distinctions, well, one is our assessments. We put high emphasis on assessment versus treatment or the latest trend. We'll spend 4 to 5 hours for someone coming in from out of town, and the majority of that is on assessing them, really trying to identify where they are. And another one of our distinctions is the synergy of this team. And I have some folks that have been there 15, 15, 20 years, some in terms of team members. And, but right now I think our average is about 10. So these people have been there working together for a long time. And the synergy that we have across a client or a patient is very unique. So they may be on the gym floor doing rehabilitative exercise. They might be up in the clinic getting manual therapy or acupuncture, or they might be getting diet nutrition advice from one of our nutrition leads. The the synergy across what they're receiving is unique. So everyone's speaking the same language, the same information, and importantly, they know that person. So, so I think that's why we hit the target sometimes when others haven't. And I had one of my team members come up the other day, and he's like, "This woman came from you know Florida, and she'd been to all these different places, and she's really had some trouble, and uh, we changed her life. What are we doing? Well, how do we do that?" I said, well, and I just kind of repeated what I just told you. I said, I think we're asking why she's in trouble, and not just treating what it is, and then because of these other things.
do you tend to have clients who are with you for several years?
Yeah, sometimes, and that's sometimes essential. I mean, they if they're coming from far away, they may only come in every quarter or and eventually every 6 months during that 2 or 3 year process. Um, we have folks local that have been with us sometimes 10, 15 years, um, just being the best they can. And that populations that's local there in St. Louis is a real healthy population. If you when we look across them, they're definitely well below their age in terms of their health markers. Um, and so we encourage accountability and independence. Uh, but the reality is, if you've suffered pain for 20 years, you've suffered pain, chronic pain for 6 years or even 3 years, it is going to require a, a significant amount of time to recover that. And as I think I speak to in the book a bit, part of the miss, part of the failings in treating some of these chronic pain situations is to tell them that they might be better in a month, but or that they have the expectation that that could improve in a month or even 6 months. I mean, if you've had chronic pain for 20 years, it is just going to take a couple of years to restore those behaviors, to restore those habits, to restore that physiology. That physiology is adapted to that. So there's a courage piece that we sometimes talk about for the individual. They have to have courage to really go after this for those 2 years. They could easily take medicine. They could maybe go ahead and just do the surgery, which sometimes is warranted. But to work at this, to change their physiology across 2 years takes courage, and it's really fun when we see it happen.
I'm reminded of my wife is going through a stress fracture,
Mm.
tibial stress fracture, uh, and I think she's into month 3. And thankfully, her physician is one of the top running physicians, well known, an author, and she's been to a woman for running rehab as well, and getting the exact same message. And for someone who's used to running every day, it
Yeah,
is really, really hard because it's a little bit different, obviously, than pain. This is the other. She feels fine,
yeah,
right?
yeah,
And so she wants to go back. But when you're with experts who really understand, it's like, no, you're not well. The absence of pain is only the first stage of the healing. And so these things are not as simple as, taking a pill can seem simple to
yeah.
resolve it, but all you're doing is essentially masking the symptom with these things. And ultimately, long term is that, I guess I always step back and say, is what you're doing today aligning with your long term goal? When I say
Mm.
long term, right into old age. So if you're thinking about taking a pain medication, are you signing up for a 40-year prescription? Whatever age you're at, because that's should be part of your thinking.
Yeah, that's great.
So I
Yeah.
think that's part of what you're getting at here is need to explore the options and really kind of consider what's at stake here long term. We've kind of talked about a few things, and I'm always kind of thinking for the listener out there. You think you're fine, all's good. I'm
Mm.
doing pretty well because again, compared to others. So we've mentioned the belly breathing, we mentioned stand on one leg. Any other kind of things you would suggest to somebody to say, what's a way just to test yourself to validate that, right? With some objective metric that you encourage them to. We talked about walking, so maybe a walking speed, like measure your walking speed and
Mhm.
say, is it 2 miles an hour? Is 2.5, 3, 3.5, 4? Those are all very telling. That's an easy one to do and very telling. Anything else you'd kind of suggest that there aren't that many that are super easy. That would There are others, but they take some explanation.
Yeah, I mean, in terms of self-assessment, certainly your ability to get on and off the floor. You should be able to get up off of the floor with minimal touches. Well, two to four touches is still a really good marker of strength and coordination and flexibility. Um, and so that's actually a quantified evaluation tool. And as you've mentioned before, so many of these tests actually become the exercise, right? So you
Right.
should, you should work it. So getting on and off the floor and get prowess with doing that with minimal touches. One of the stories in my book, the Bert as a cowboy in New Mexico who he first consulted me. He was on crutches, and through some things we did. We got him riding his horse, and I was doing a virtual consult with him, and I hadn't trained him on this, but he said, "Yeah, and I'm getting off the floor without using my hands." I'm like, "Well, what? What do you mean you're and he'd figured it out. He'd figured out how to get up without using any hands. This is a guy who was on crutches when I first got him, and I said, "Bert, I can't do that. So you're just you've gone past me." So yeah, on and off floor, um, and trying to maybe, and we talked about this I think the other day, grip, and I think you maybe even had it in one of your recent writings. Grip is one of the highest predictors of living a good long life, and that's an easy thing for someone to measure for you. And you probably, if you don't want to get your own dynamometer to assess, uh, the practitioner who has one, probably a good practitioner. uh, and 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 so a good grip is another good thing that would tell you, hey, I'm stressing my body enough to do that.
Yeah, as you're talking about it, I'm remembering, if people are listening, these are all indicators of a much bigger story, right? The grip
Hmm.
strength is the one. If it's really not about the grip strength, it's what the grip
Right.
strength represents, right?
Oh yeah, it's your ability to generate force into your hand, not necessarily hamstring. Your hands connected, um, but it's your ability to generate force out there, which comes from your trunk and largely your nervous system.
Because you've been doing things to reinforce it and build it, right? It's not, yeah, the training isn't to sit in a chair and do grip strength. It's
No, I know. I'll get that. So my clients come back, yeah, I've been working on this. I'm like, no, 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 no. No, the best way to increase grip strength is to lift things,
yeah,
actually. Yeah.
excellent. Well, I want to respect your time and circle back and talk to you a little bit more. I ask you to maybe talk a little bit more about your mission to move 100 million people. I'm going to throw the book up here so that people who are watching on YouTube can see it. But it's The Power of Doing What Matters is your book that just absolutely captured me, which is why we're having the conversation here today. Um, the goal of movement, I think, is really just gets to the core, right? Of what do we need to do? Humans were made to move. So, what does movement mean to you, and why? What would be as more the? I think, well, you can speak to it however you want. Let me. I think there's the societal impact, but ultimately the
Yeah,
individual out there is the one who's going to be, what's in it for me.
sure, sure. Well, and this is another little subtitle on the book, the mind body resilience in all of us. And the point of the movement is it is in all of us. We all have this amazing potential if we just often get out of the way and let that resilience come through. And what I mean by that is we're often doing all these other things. We're chasing the latest biohack trend, or we're watching TV, or working all the time, and we're not allowing this resilience in us to come through. We're not reading a book for 30 minutes a day. And as we talked about, reading a book for 30 minutes a day increases your longevity about 20%. I mean, it's extraordinary. Uh, and so this movement again is to inform folks and hopefully create this collective idea, like gluten free, that we just uh, start looking for the things that matter for us, and I think there are ones that are unique for some. They're like diaphragmatic breathing may not be essential for someone who's already got a good yoga influence or practice. But reading maybe is one they need to do. So there's just many things under this umbrella, uh, but it just requires putting attention to these things. And I think there's good attention surfacing about um, longevity and health span. I love the some of these things that are happening, and yet we're not doing them. We're still doing all these other things. And so the idea is that we underpin all this movement of towards taking care of ourselves with some simple thoughts and some simple applications.
Right. I think in the word matters a lot, right? Because it's easy to be caught up in all, and I think that's partly why you and I are so aligned on so many things. Is there's this basic, philosophical belief around there. The world is mostly filled with distractions, even
Mm,
in the area of places we're trying to help. Is
100%.
we're competing with all of these distractions, the latest, greatest hack. Um, when I grew up, a hack was not a popular adjective that you would want applied to you,
Right.
and it stuck with me. And so, yeah, I'm not. I'm. This is all built on data that we have enormous amount of data on,
Yeah.
right? Not one or two little studies. That's the work I'm doing right now. So I'm tapping into all the research that you've been, using your whole career, and I'm just amazed. There's so much great research, so much certainty around it. So we talked earlier about certainty versus uncertainty. All the areas where you're working to me are filled with enormous certainty. And that's really what you should be looking for in this, not the magic pill, because it isn't coming, folks.
Oh, 100%. And it really kind of circling back to the beginning of our chat, all those complexities, all the complicated things is actually squeezing the glass. You'll often sense where you are less. You'll be able to tell the difference less because of the complication. It may feel better. You may even look better aesthetically, or um, uh, but your nervous system is taking a hit. Your nervous system is likely taking a hit, and the nervous system, guess what it's connected to? Your immune system. I mean, that's what's so well defined and understood. As much as we understand things, we're still not really full understanding things, but the nervous system and the immune system are like this.
Yeah, it's a gray line between the two, right? In terms of they are so intertwined. Yeah, not. Thanks for raising it up. It's rarely mentioned in the world of in terms of social media and all the other things out there. Yeah.
Yeah. And lastly, on just finishing on that complexity part, the body loves simplicity. I mean, what do you enjoy doing? Coloring a photo or coloring a picture, or, or putting together a cabinet with all these different instructions from somewhere. I mean, the body loves. I mean, you might like putting the cabinet together, but
I like putting it together without the instructions because the instructions
yeah.
just frustrate me
Yeah.
because they're usually poorly written.
Okay. But yeah, so the instructions though, they diffuse you. They're like, right? Yeah,
Right.
yeah. So and so to just keep throwing complexity at our solutions, um, the body just doesn't like it, and it won't lead to positive adaptations. And usually the big thing is it won't lead to consistency or sustaining activity. With oh, these compression pants, oh, they're amazing. Um, this latest thing, it's amazing for a while. For a while.
Right. Well, Dr. Skaggs, thank you so much. This has been a just a fascinating conversation. I could sit here with you and we could go way too deep for people to to want to cling on to. But no, I think there's just you really raise up, I think, a lot of really important points. And I think the last one you really got there was around sustainability, right? Everything we're thinking to do should have a sustainability attached to it. If you aren't convinced you can do it for a long time, maybe you should be thinking about starting something else, right?
I love that. Love
Or you're
that.
not ready for it, whatever reason. But oh, thank you very much. Thanks for writing the book. I'm looking forward to seeing the 2.0 as this continues to evolve. So I'm trying to do my part to contribute and help it along. So let's try to promote functional aging in terms of keeping our function and using that as a good metric for people. So thank you so much, and great to hear about the clinic. And I'll put some notes in the at the bottom in terms of how to reach the clinic and the book and everything else I can possibly think of.
Great. Well, I really appreciate it, Scott. Thanks. Thanks for reading my book. Um, I was really grateful that you did and liked it.
Absolutely. Thank you.
All right. Thanks.
Hope you enjoyed today's show. Great to have you part of our over 10,000 strong Healthspan community. Remember to subscribe if you'd like to learn about our upcoming shows. And as always, make sure you provide some feedback, whether that's a thumbs up or a comment, a question. They're all welcome. If you'd like to subscribe to our quarterly newsletter, you can do that at wealthspan.com. We're always looking for show ideas, or maybe you think you'd like to be a guest. Again, please reach out to book a motivational talk or inquire about our leadership workshops. Email me at info@wealthspan.com. Until next time, stay engaged, stay curious, and take good care of you and those in your care.